So today's video is on hypotension, also known as low blood pressure. So low blood pressure is a condition in which the force of the blood pushing against the artery walls is too low. This is also known as hypotension. So blood pressure is measured in millimeters of mercury, units known as mmHg. In general, low blood pressure is a reading lower than 90 to 60 mmHg. So interestingly, what's considered low blood pressure for one person can be okay for someone else. Low blood pressure can cause no symptoms that you notice, or it might cause dizziness and fainting. Sometimes low blood pressure can be life-threatening. So the causes of low blood pressure include dehydration and other serious medical conditions. So it's important to find out what's causing it so it can be treated. So there are different types of low blood pressure, and I'll go through them. So the first one is orthostatic hypotension. This is also known as postural hypotension. This is a sudden drop in blood pressure when standing up or lying down. Causes include dehydration, long-term bed rest, pregnancy, certain medical conditions, and some medicines. This type of low blood pressure is common in older adults. The next type we have is postprandial hypotension. This is a drop in blood pressure 1 to 2 hours after eating. It's most likely to affect older adults, especially those with high blood pressure. The risk is also higher for those adults with Parkinson's disease or other conditions that affect part of the nervous system, which controls autonomic functions such as breathing and heart rate. This is called the autonomic nervous system. Certain lifestyle changes can help ease symptoms of postprandial hypotension. So you can eat small, low carbohydrate meals, drink more water, and stay away from alcohol. You also have neurally mediated hypotension. This is a blood pressure drop that happens after standing for a long amount of time. This type of low blood pressure mostly affects young adults and children. It can result from communication trouble between the heart and the brain. You also have multiple system atrophy with orthostatic hypotension. This rare condition affects the autonomic nervous system. Multiple system atrophy with orthostatic hypotension is linked with having very high blood pressure while lying down. It is also used to be called Scheib-Zager syndrome. So for some people, low blood pressure can be a symptom of an underlying health condition. So this is the case when the blood pressure drops when low blood pressure occurs with symptoms. And a sudden fall in blood pressure can be dangerous. So even a change of just 20 mmHg can make you feel dizzy or faint. For example, those symptoms that can happen after a drop in systolic pressure of 110 mmHg to 90 mmHg. And big drops can be life-threatening. So these can be reasons such as serious bleeding, serious infections, or allergic reactions. So extreme blood pressure can lead to a condition known as shock. The symptoms of shock include confusion, especially in older people, cold, clammy skin, pallor, rapid shallow breathing, weak and rapid pulse. And these are other common symptoms: blurred or fading vision, dizzy or lightheaded feelings, fainting, fatigue, trouble concentrating, and upset stomach. So low blood pressure has various causes. Some health conditions and the use of certain medicines can cause it. Other factors can affect the blood pressure as well. So blood pressure is determined by the amount of blood in the heart pumps and the amount of resistance to blood from the arteries. So there's two readings: the systolic pressure and the diastolic pressure. So the systolic pressure, this is the top number when the pressure in the heart beats, and the diastolic is the bottom number when the heart rests between beats. So normal blood pressure is known to be 120, so 80 or less, and it does vary throughout the day. It can depend on your body position, breathing, food and drink, medicines, physical conditions, stress, time of day. It's usually the lowest at night and rises sharply in waking. There are reasons as well that I'll go into more detail. So there's pregnancy. So pregnancy changes during pregnancy cause blood vessels to expand fast. The changes can cause blood pressure to drop. Low blood pressure is common in the first 24 weeks of pregnancy. After a person gives birth, blood pressure usually returns to the level that it was before pregnancy. Heart and heart valve conditions. A heart attack, heart failure, heart valve disease, and a slow rate called bradycardia can cause this. You have hormone-related diseases such as endocrine conditions. Conditions such as Addison's disease that affect certain glands that make key hormones can cause blood pressure to drop. You also have hypoglycemia and potentially diabetes. So with regards to dehydration, when the body doesn't have enough water, the amount of blood in the body declines. This can cause the blood pressure to drop. Fever, vomiting, severe diarrhea, overuse of diuretic medicines, and strenuous exercise can lead to dehydration. Also, blood loss as well, resulting in reduced blood volume and therefore less blood pressure. And reasons that can happen is severe infection, resulting in septic shock and septicemia, a severe allergic reaction, also known as anaphylaxis, lack of nutrients in the diet, so low levels of vitamin B12, folate, and iron can keep the body from making enough blood cells, and lack of healthy blood cells is known as anemia. This will lead to low blood pressure. So anyone can have low blood pressure. Risk factors include age, so a drop in the blood pressure when standing up or after eating occurs mainly in adults older than 65. Medications, these are also risk factors. Certain diseases such as Parkinson's disease, diabetes, illegal alcohol or drug use. So complications can be dizzy feeling, weakness, fainting, injury from falls, and severe low blood pressure can lower the body's oxygen levels, which can lead to heart, brain, and damage. For your diagnosis, so blood tests can help find symptoms of other conditions like low blood pressure. These include low blood sugar, also known as hypoglycemia, high blood sugar, also known as hypoglycemia or diabetes, and a low red blood cell count, also known as anemia. You can have an ECG done, electrocardiogram, so this quick and painless test measures the electrical activity of the heart. Or you can have a tilt table test, which can study how the body reacts to changes in position. This test involves lying on a table that's tilted to raise the upper part of the body. This mimics the movement from lying down to standing up. Straps hold the body in place and the heart rate and blood pressure are tracked during the test. So low blood pressure without symptoms or only mild symptoms rarely requires treatment. So if the low blood pressure causes symptoms, the treatment depends on the cause. For example, if the medicine causes low blood pressure, you might have to change or stop it, or the dose can end up being changed. If it's not clear what it is, if there's no treatment exists, the goal is to raise blood pressure and relieve symptoms. So this can be done in a variety of ways. Firstly, use more salts. So if you limit your table salts and foods high in sodium, that's because salt and sodium can raise blood pressure, sometimes by a lot. For people with low blood pressure, though, this can be a low good thing. Too much salt or sodium can lead to heart failure, especially in older adults. Drink more water, so fluids increase the blood volume and help prevent dehydration, both of which are important in treating hypotension. You can wear compression stockings, so these are also known as support stockings. So these elastic stockings are often used to relieve the pain and swelling of varicose veins. They improve blood flow from the legs to the heart. Some people have an easier time using compression belts around the stomach area than they do using compression stockings. Compression belts are called abdominal binders. Medicines. So various medicines can treat low blood pressure that occurs when standing up, also known as orthostatic hypotension. For example, the drug fludrocortisone boosts blood volume. It is often used to treat orthostatic hypotension. So if you have long-term orthostatic hypotension, midodrine can be prescribed to raise standing blood pressure levels. The medicine lessens the ability of the blood vessels to expand, which raises blood pressure.